Respected Chairperson and Latin audience, Assalamu alaikum. I am Dr. Mohammad Kalim Uddin, Assistant Professor, National Heart Foundation Hospital and Research Institute, presenting wave-wise comparison of demographics, clinical characteristics, and in-hospital outcome of COVID-19 pandemic in Bangladesh. The single-center study. COVID-19 is the most devastating epidemic caused by severe acute respiratory syndrome. Coronavirus was first identified in Wuhan, China in late December 2019. Bangladesh faced first wave of COVID-19 without preparedness like other countries. But vaccination, recruitment of more healthcare personnel, addition of more hospitals and ICU facilities lead to proper preparedness against COVID-19 during second wave in Bangladesh. Ahmed and associates, by analyzing genomic sequence, discovered that the wave 2 samples had a significantly greater average rate of mutation than the wave 1 samples. The infection rate and the death rate showed a significant difference between the two waves in different territories around the world, but there is lack of data regarding wave-wise comparison of epidemiological and clinical characteristics of COVID-19 outbreak. This study aimed to compare the demographics, clinical characteristics, and in-hospital outcome of two waves of COVID-19 pandemic in Bangladesh. This prospective cross-sectional study carried out in the National Heart Foundation Hospital and Research Institute. First wave was from 3rd April to 2020 to 28 January 2021, and second wave from 27 February 2021 to 25 September 2021. WHO defined a pandemic considered better control if the infection rate is below 5. This definition was considered for wave-based characteristics in our study. It is data from DG Health, and inclusion criteria was COVID-19 positive patient by RT-PCR, and all admitted patients who became COVID positive are included in this study. Exclusion criteria was suspected COVID patients, and the study was approved by Ethical Review Committee of Heart Foundation. The disease severity was classified as mild type, moderate type, severe type, and critically ill patient. This is comparison of baseline characteristics between the first and second wave in Bangladesh. First wave includes 727 patients and second wave 858 patients. Mean age of the patient was 48 years in first wave and second wave 50.65 years. And aged 21 to 40 years more prevalent during first wave, and aged over 60 years were more prevalent during second phase, which is statistically significant. And male were predominant in both phases, and healthcare personnel are less affected during second wave because of, I think it is the effect of vaccination. And the first wave there was 30.7%. And comparison of baseline characteristics between first and second wave Bangladesh, and risk factor, regarding risk factor and comorbid condition, during first wave dyslipidemia and obesity was the most common risk factor and comorbidity, and during second wave hypertension, cardiovascular disease, and chronic kidney disease. Without comorbidities, there was prevalent during first phase, and this number of risk factor and comorbidities. And vaccine status. During first wave, vaccine was not available in our country, but during second wave, vaccine was available. And among infected patients during second wave, 80% patient was unvaccinated. And those who received first dose vaccine, they were involved 14.6% and 4.9% who received second and first dose vaccine. And asymptomatic patients were more prevalent during second wave, and fever and cough was predominant during both phases, but symptoms were less prominent during second wave. And COVID-only diagnosis was 38% during first wave and 16.4% during second wave, because it may be due to reduced number of healthcare personnel in our hospital. And in-hospital outcome is as mild and moderate and critical patient were predominant during first wave, and second wave asymptomatic and severe ill patient were more prevalent. We plot a unified analysis of in-hospital outcome of study population, age group, healthcare personnel, non-healthcare personnel, cardiovascular disease, EF category, disease severity, diabetes and hypertension was significant, but in multivariate analysis, age more than 50 years, severe LV dysfunction, severe and critical form disease was predictor of mortality. So important findings of our studies are healthcare personnel were less affected during second wave. Patient aged 21 to 40 years were more prevalent in first wave. Patient aged more than 60 years were more prevalent in second wave, and vaccinated people are less affected by COVID-19. COVID-19 related symptoms are less prominent during second wave. Asymptomatic severe disease form prevalent in second wave. Mortality rates were higher during second wave, and age more than 50 years, severe LV dysfunction, severe and critical ill patient were the independent predictor of mortality. Islam and Associates carried out cross-sectional study to compare the epidemics of two waves in Bangladesh from the data of suspected cases from local authorized diagnostic center, and they found male were predominant during both phases, and people under 41 years were 5.6%, and in second wave 65.6%. They also found 128 patient positive cases among international travelers. Hossein et al. Conducted cross-sectional study at Sheikh Russell National Cardiovascular Institute on 486 admitted cases during the second wave, and they concluded during second wave older patients were affected more and mortality rate was also higher in previous studies. Cough and fever were the most predominant symptom, and while hypertension and diabetes were the most common comorbidity as our study. Study conducted in a non-COVID dedicated hospital, it is our study limitation. Genomic variants were not considered, COVID variants were not determined, and the brand name of the vaccine was not included. So in conclusion, the first wave, in comparison to first wave, during second wave, healthcare personnel were less affected, symptoms were less prominent, asymptomatic and severe disease form were more prevalent, and mortality rate was high, though it was not statistically significant. And vaccinated persons were more prone to infection, and age more than 50 years, severe LV dysfunction, severe and critical ill patient were the independent predictor of mortality. Thank you for patient hearing.